여러분들 안녕하세요. 한양대병원 박창주 교수입니다.
Hello, I'm Professor Changju Park of Hanyang University Hospital. So today we are going to surgery for number 24 and 25 implant of 56-year-old female patient. So what is the point of today's surgery? First is that 24 after extraction, immediate implant placement, and between implant and buccal bone, collagen will be used as a bone graft material. Second is that, as you can see, this patient on the panorama view has impacted tooth, especially 24, and it overlaps with 24 and 25. Because of the second caries on 24, the bridge has to be removed, and in delivering implant, when you do surgery for 24, leveraging the advantage of digital guide, avoiding the impact tooth using one guide was the focus. Will be the focus in surgery. And number 3, number 25 implant, the impact tooth in there will be partial engagement. So I believe there is a room for argument in such approach. But watch out for these 3 points in the online surgery. So first, through one guide study, 24, as much as possible, try to go around the impacted premolar. But for 25, it was on the upward position, so we designed for partial engagement. As you can see, the hard tooth indicating bone quality here. And according to this report, it's actually D2. So why, you might say, are we doing this type of crazy thing? Conventional way is impacted teeth needs to be extracted, and after making bone in that site, you do implant surgery. But after extracting impact teeth, especially for elderly patient, that site does not really fill up with bones. So you need massive GBRs, many cases, which means a lot of struggles and difficulties for patients. And then I came across this literature. This one started with case report, and through long-term observation, it became case series, even long-term follow-up. Complications is very hard to study because you cannot create intentionally complications. So it's very hard to do patient comparisons. But like this, if there is something wrong in implant, but observing that to make sure there's no issues, especially if there is impact teeth or ankylosing related, and even if you engage implant, there's no problem. There are many evidences in the literature that shows that. So we fully discussed with the patient, and rather than extraction in GBR, in some parts, implant engagement was possible. So that type of kind of agreement or promise was made with patients. Of course, if there's any issue, there will be emergency response. And especially 25 would engage the implant. I hope that you will watch out for that. So let's go to the surgery.
선생님, 편하게 놀고 계세요. 이렇게 뽑은 거예요. 선생님, 알아서 드세요. 네. 잠깐만. 들어가십니다. 이렇게. 이렇게 있죠? 아유, 잘하고 계세요. 팔점을. 그럼 누르고, 네, 좀 잡는 거. 잘하고 계세요. 바이오스 콜라겐 준비. 이렇게. 자, PS3 4.5에 8.5 소니입니다. 하세요. 네, 그러면 그냥 오스템의 원페이스 본 프로파일러입니다. 뒤에 거죠. 이건 커튼. 예.
So,
어떻게 보셨는지
what did you
모르겠어요.
think? This
이것이
is
촬영된
panorama just after surgery. Initial stability is good, so healing abutment has been connected. And on the panorama, 25 implants, as the tooth was very hard, drilling was a bit pushed. And the implants was also slightly tilted as a result. So if you compare the cone beam CT, it's a pre and post-op comparison, and number 24, very clean extraction without touching buccal bone, and implant has been delivered going around the impact tooth. So collagen bone graft material has been filled up nicely. The issue is with 25, and implant here, as we had expected, slightly engages the impacted tooth. As the tooth is hard, drill has slightly been slide or pushed. But again, initial stability is good, and healing abutment has been connected successfully. If there is a chance, maybe a bit long-term follow-up can be possible to look at what happens when you engage the impacted tooth, maybe next time. But anyway, I'll see you next time with more interesting case. Thank you very much.